By the time your partner is in active labor, you will likely need to start using some comfort measures to help get her through the contractions. I will show you a few, but your main job is to love your partner and that baby like no one else can in the room. You know what she likes, how she likes to be comforted, what to say, and more importantly, what not to say. These comfort measures will help alleviate some of the physical discomfort. They probably won't all work. Think of them as tools to keep in your tool belt, but you're not sure exactly which tool is right for the job. So just keep trying them as needed. There is a chance she won't want to be touched at all, and that's okay. Just follow her cues. The first tip I'm going to give you isn't really a comfort measure, but it helps so much in labor. And that is to offer her a drink of water, preferably with a straw, after every contraction. You don't need to say anything unless she hasn't had a drink in a while, in which case just encourage her to take a drink and remind her she needs to stay hydrated. But most of the time, just hold up the straw to her lips and she'll take one if she wants one. Also, make sure she knows what she's getting. One of my clients had water and Gatorade, and without telling her, her husband switched from giving her water to Gatorade, and she took a big drink of Gatorade when she was expecting water, and it totally took her out of her rhythm. It's those little nuanced things to be aware of, where if you do everything right, she will have no idea, but if you mess something up, it might be the one negative thing she remembers, so no pressure. But hopefully you'll be able to laugh about it down the road. And remember, if she's drinking a lot, she'll have to use the bathroom a lot. Encourage frequent trips. Movement is great for labor, and the toilet is one of the best places to labor. And emptying her bladder frequently will help keep it out of the way of the baby's path through the birth canal. One more thing, make sure your breath is fresh. Have some mints or gum handy. Nobody wants to smell your coffee breath in the thick of labor. Okay, back to the comfort measures. These first few comfort measures are great for early labor, and I'd recommend trying these until they are no longer effective. And then you can bring out the big guns. So first, essential oils or aromatherapy is great for helping manage pain, anxiety, help her sleep, and relax. If your partner is into essential oils, you can utilize her favorites. They can be diffused, massaged into her body, or my favorite is to put a few drops on a wet washcloth and she can hold it up to her nose when she wants to smell it. The reason I like this method is because in labor, your taste can change in an instant, and something she's enjoying can make her throw up the next minute. So if it's just on a washcloth, then you can easily toss it aside and the scent is gone. It's harder to do this if it's in the air or on her body. I won't get into specific scents of oils, but there are some that aren't considered safe for pregnancy. So just be aware of that and double check whatever oils your partner may want to use. The next is comforting touch. This can also really help. This can include acupressure, hand and foot rub, light stroking, firm massage, holding, hugging, cuddling, that kind of thing. I love the slow dance in labor between contractions because it helps her relax, stay loose, and keeps that oxytocin flowing. Nobody knows the type of touch your partner likes more than you. So this one should be easy for you. Keep in mind that you should not make any sudden changes in touch, especially during a contraction, unless she tells you to stop. Another comfort measure that can be nice throughout labor is change in temperature. Like a heating pack on the lower back or lower abdomen can help with some of the pain. Ice packs as well, but not as often in my experience. A cool washcloth is usually great on her forehead, chest, or the back of her neck if she's warm in a bath or heating up from labor, and it's definitely usually welcomed during pushing. And again, one moment she can be freezing and the next she can have a hot flash and be sweaty. So just be aware of your partner's cues. Hydrotherapy is great throughout labor for most women as well. Showers can feel really nice. If you or the birthing place has a handheld shower head with different settings on it, you can essentially use that to massage her or let it hit her lower back or belly. Baths can be a great tool for pain relief, but they can slow down contractions. especially if it's still early. So they are best utilized in active labor and transition. They are also great for helping women relax. So if you notice your partner can't quite let go of tension during and in between contractions, maybe suggest getting in the bath no matter where she's at in her labor. One of the most popular comfort measures in the doula world and birth world, and can be the most effective, especially with back labor, if you've heard of that, is the double hip squeeze. It can help relieve lower back pain, help reposition a baby who is facing the wrong way or having a hard time descending. So how do you do it? As her contraction is starting, she'll likely lean forward. You put your hands on her hips so your fingertips are at the top of her hip bones. Leave your palms in the same spot as you rotate your fingertips facing each other. Squeeze your palms together, applying as much pressure as she needs. Keep the pressure constant throughout the whole contraction. And when it's over, don't just take your hands off suddenly. I like to gently rub my hands up and down her back a few times and then gradually lighten up the touch until you can take your hands off. Shake your arms out and get ready to get back at it. A couple tips for you are to keep your shoulders down away from your ears. Don't hunch up like this. You're going to get really tight. And try to bend at the knees or legs rather than around your back. You may be doing this for hours if she needs you to, and you absolutely cannot stop, and you definitely can't complain because you're tired. The next is similar to the double hip squeeze, but easier on you and easier to apply in certain situations, like when she's in the bathtub or lying down on her side when you can't get to her hips, and that's counter pressure. Apply a firm and constant pressure to her lower back, sacrum area throughout the whole contraction, unless of course she says stop. You can use one hand, two hands, your fist, or a hard ball like a lacrosse ball, or if you have a massage ball, something like that. Again, play around with the placement and pressure before labor so you both have an idea of what she likes. I'm going to briefly talk about encouragement. I'll put some great encouraging and empowering statements in the notes, but just remember to encourage and validate her feelings. If you tell her she is so strong and doing an amazing job, it's going to help her believe it. Remind her why she's doing this, that each contraction is bringing her baby closer. Remind her to trust her body and baby, and that they are doing exactly what they are supposed to do. Good luck. You to move your hands higher or lower and give more or less pressure, so just make sure communication is open. And practice a few times before labor begins so you're comfortable with this when the time comes.